Information and Communications Technology, or ICT, is changing virtually every aspect of how we live our lives today. It's changing how we bank, how we receive entertainment, how we book holidays, how we communicate and engage with one another. And these are the same technologies that are transforming how healthcare is delivered across the world. And again, these are the same technologies that we want to embed into our hospital to deliver the vision of a digital hospital going forward. In clinical terms, we are going to implement an integrated electronic healthcare record, or EHR. This will replace our existing paper medical records, and it will be the primary or go-to place for all key clinical information. It will store demographic information about the patient, it will store clinical notes, clinical tests, etc. What this will allow us to do is to capture data once and reuse it in multiple scenarios and over multiple time periods. In essence, then, what we will do is we will make this information available at any time, any place, to every clinician who needs to use it. Over the next few minutes, you're going to hear from a range of healthcare professionals across our hospitals, and they're going to give you deeper insights into how what we've been talking about is going to improve patient care, improve patient safety, and improve the efficiency with which we deliver our services.
One of the key benefits of moving to the new Children's Hospital, will be the single integrated care pathway in the electronic format.
What I would see is that the electronic healthcare record will actually help us to knit all of that information together to be accessible by any team member when they need it for the purpose that they need it for.
I think the new digital hospital will benefit all areas of the working environment for nurses, doctors and all healthcare professionals.
I think it will be hugely beneficial, especially for the patient. We will be able to access all patient information and detail in the one place.
We can come up with some solutions to solve the problems that we have today. So I see this for physiotherapists as improving multidisciplinary team communication by using one electronic patient record.
So from my experience in the implementation of electronic health record in Qatar, the main benefits were that degree of standardization that all clinicians had agreed to in advance. It just made it easier to deliver.
So from my experience working on wards, in the last number of years especially, a huge amount of your time is taken up where you're going back to the nurse's station, writing up notes, you're looking for charts, you're getting drug charts, bringing them in and out. To be able to do all this at the bedside on a PC, I suppose it just means that you can spend more of that time. That having that digital system where you can do everything from the bedside means you are with that child and you are with that family, and you are there as a resource for them to ask questions as well as care for them.
I think there's probably four main areas. The first of these is that I or any other clinician will be able to access patient information whenever and wherever I need to. The second is that I will be able to access all of the information. We're increasingly moving towards multidisciplinary care. Care is becoming increasingly complex, so I will be able to look at the information provided by the other clinicians involved in a patient's care, other health and social care professionals, the emergency department, medications, investigations, everything I need to know in order to make properly informed decisions about a patient will be available to me in one place when I need it. The third really important and exciting area is medication safety. Electronic prescribing is proven to make prescribing medication safer and to reduce medication error, and that is good for everybody. And I suppose the fourth is that we do a lot of tests on patients, we see a lot of patients, and in order the system can be set up to alert me that when I've ordered an investigation, a test, an x-ray, a scan, the system can alert me when it's done and provide me with the result so I can act on it immediately, and that is better for patient care.
The top benefits really are efficiency, standardization and ultimately patient safety.
Telehealth is a key part of our design. We will see the technologies and the capabilities that we're building into the new hospital, which will enable video communication both to and outside the hospital. So we can see in the future telehealth between consultants and patients happening possibly between the home and the hospital itself, and then we can start to avoid unnecessary visits to the hospital. A number of years ago, HIQA produced a report and they estimated that actually up to 30% of the total healthcare budget was taken up with the costs of collecting information, retrieving it, storing it and moving it. And can you imagine, as we move from the paper world into the electronic world, if we can just release a portion of that and be able to deploy that into healthcare, the transformational effect that can have in how we deliver care.